Okay, let's go. Just roll with it.
Makes sense.
Oh, this is so bad.
So open up. No, it's okay. Open up a conversation.
I think once we start talking to each
Yeah.
other,
I know,
Yeah.
right? Oh
Good.
my God, why am I so
Natural.
nervous?
Yeah.
I've never been the host of.
Hello everyone, I'm Dr. Iman Thalia, the medical director of the Rosewood Clinic, and today I am behind the mic. Usually it's my husband Greg, but I fired him because he was too noisy. So today I'm not alone. I'm joined by two amazing guests with me here, Dr. Deanna Halim, our functional medicine doctor at the Rosewood Clinic, and Dr. Krish, our cardiometabolic health expert.
Hi, Dr. Iman.
Hi. And you've got a very deeply inspiring personal story, which I love to hear. And I think all of our viewers here would love to hear that story again. Oh, no, they've not heard it before, but I have. And I would love to let them listen to it because I think it's very, very inspiring. And maybe you can start by, sharing your personal story and what was basically like your biggest turning point.
Okay, so what happened was in my late teens, when I just went into pre-med, I was diagnosed with diabetes type 2. And at that point, of course, there were a lot of other symptoms that came about, which was not diagnosed at the time that it should have been diagnosed. If I look back now, I think I was already pre-diabetic from the age of 16, but the diagnosis was missed simply because the parameters for diabetes diagnosis is obviously high sugar levels and, high HbA1c. But what happened was I started gaining a lot of weight towards my late teens and came to a point where my insulin resistance was very prevalent and very evident in my physical body. And that alerted my parents to take me to the doctor. Okay, so I was diagnosed in the hospital, in one of the very popular hospitals in KL, and by an endocrinologist who put me on metformin, a very common first-line diabetic drug. And I was sent off to medical school to continue my studies without telling me anything else. But fortunately for me, being a medical student, I had some insight to actually go and study about my health. And then I realized what was the basic problems. And that's when I really started my challenge of trying to lose my weight. But what happened before that was, because I was in a hostile environment and I didn't get to eat the kind of food that I'm supposed to eat, my diabetic levels actually escalated. And I was told to get on to insulin jabs. So at that point, I became really worried and decided to take charge of my health. And at that time, there were no YouTube podcasts, there was no literature online, and internet was not even there, I think at that point. So everything was textbook knowledge, and it was very hard to find out things actually at that point. So what I did was I just started losing my weight, walking 6 kilometers a day, cutting down all my sugars. And I noticed after 6 months, my waistline came down a few inches. I felt much better. I was on insulin jabs though. And I remained on insulin injections right up to the time I delivered my first child. Simply because I was a medical doctor. And being a medical doctor, you know how it is. When you're diagnosed diabetic, you're diabetic for life. Mm-hmm. So I did not know that I could reverse my diabetes at that point. So the question is what I did, right? So basically what I did was just go on a very strict diet, basically totally remove all simple carbs from my food, and exercise a lot. And then I achieved a very attractive HbA1c of 4.6 at the point.
Wow.
Yeah,
That's
I
amazing.
can always remember that number.
This personal experience that you have and how do you feel that has shaped the way that you look at your patients or guide your patients who are going through something similar?
What I definitely like to do is, or I'd love to do, is to give them the motivation and empower them because it can be done. It honestly can be done. It's just whether they are motivated enough to go through the journey. And if they are, then it can be done.
Yeah.
Yes.
And you are living proof of that.
Yes, yes, I am.
Yes.
Yeah.
Okay, so moving on, I've got a few questions for Dr. Deanna. All right, so we often hear this, word metabolic health. It's become like a buzzword, right? What is it? Can you break it down for us so our viewers also understand this?
Metabolic health is simply how effectively your body processes and utilizes energy. Okay, so how well your body converts food into fuel, stabilizing the blood sugar and managing inflammation. So that's, to summarize it, metabolic health, that would be it.
Okay.
This most simplest form.
Mm-hmm. And why is it that, poor metabolic health is now, this can be a question for both of you. Why is it that poor metabolic health now is becoming the silent epidemic?
It's everywhere.
Yeah.
It's just that nobody knows.
Mm-hmm.
Because you can look fine, you can feel fine, you're not gaining weight, your size remains the same. But behind the scenes, you're already brewing this insulin resistance, this inflammation, this brain fog or the energy crash. That's all the signs
Yeah.
you're leading towards that. It's just that maybe we're too caught up with work, with our studies, with our daily life, chasing this and that. And maybe we just forget about our own terrain, our body.
Yeah.
Yeah, we tend to sweep it under the rug. It's fine. This is normal. This is normal. This is normal. So yeah, that's how I feel like that's why it slowly becomes a silent epidemic.
Yeah. How do you feel, how does functional medicine differs in terms of conventional medicine when it comes to, addressing these metabolic health issues?
Both medicine are the same, okay? Technically, we want people to live better. But conventional treats after the number has gone beyond what's normal. So everybody is saying, oh, my numbers are normal. My numbers are within the normal range. So I'm not supposed to change anything yet. But functional likes to ask why. So let's say you come to the clinic and, I'm experiencing some brain fog, slow recovery, muscle. Previously, when I was in my 20s, I could stay up all night and function the next day, but now I cannot. So we like to ask, okay, why? The number one question is why? How did you get there? What was your daily routine? How's your diet? How's your lifestyle? How's your sleep? How's your movements? How's your stress level? How do you manage your stress? So in conventional, probably because you don't have so much time to ask a lot of those questions, particularly number one, obviously, because you have a number of patients to cater. So I feel like in functional, that's how we focus on that.
Yeah.
We can spend more time on patient understanding about their lifestyle.
I completely agree. And I feel I have been, at a desk, clinic kesihatan, like community clinics. You just don't have time to talk to patients. It's just like literally touch and go, right? And you just, kind of go through their books and then it's like, oh, okay, you've tried these different medications. It's not working. Maybe we're going to have to put you on insulin now, right? And then we just have 1 minute just to talk about diet. Okay, but you do have to, stop eating sugar, stop eating the carbohydrate. But that should be the bigger picture, because that is actually essentially the root cause of why this keeps happening, right? Why they're not able to control their blood sugar, why their HbA1c is always high, right? What do you think, Dr. Krish?
Yeah, exactly.
Right?
Because conventional medicine, we work very well with diagnosis. When it comes to conventional medicine, we have to diagnose the patient, then we know how to treat. But with functional medicine, we don't need to diagnose them and put them in any particular box. We just look at their baseline issues, we look at their health, their diet, their lifestyle, listen to their complaints, and do a very detailed lifestyle history, which can take almost an hour and a half sometimes, right?
Yeah.
We spend so much time talking to
Yes.
the patient. And what we also do is we give back the control to the patient. I think that's the biggest and the most beautiful part of functional medicine compared to conventional medicine.
Yes.
Yeah, like what Dr. Deanna says, right. Both do a fantastic job in treating patients, but in acute conventional medicine, the doctor holds the control because doctor decides what's best for you. So it's 95% doctor, 5% patient.
Yeah.
But when it comes to functional medicine, it's 95% patient and only
Yes.
5% doctor.
Yeah.
So what we do is we do a lot of hand-holding, we do a lot of advising, we direct them to the right way, we go back into their nutrition, their diet, their lifestyle. We go back, we try to bring them back to balance, to normalcy, which is what we call in medical terms homeostasis,
Yeah.
right?
We're just talking about, the real disease here is not diabetes, it's not heart disease, it's not high blood pressure, right? It's the disease of metabolic derangement. And that's actually the root cause of why, all these symptoms are coming up. And this is essentially what functional medicine is, right? And finding out the root cause and bringing the patient back to homeostasis. So I love the word that you use there, which is homeostasis. I think that's what we always try to achieve with our patients, trying to bring them as close as homeostasis as possible. And I think this really brings it to this special occasion that we're having this month, which is the launch of our metabolic health program on the 12th of September. And I'm really, really excited about this. I just want to kind of discuss this further with you guys because we all came up with it together.
Yeah,
and
we all are excited.
we did. Yes, yes, and we're excited.
Yeah, definitely.
Yes, and I just want to ask you, Dr. Deanna, why did we come up with this program?
So of course, we all agree that every disease, every known disease at least, it all begins with a derangement of the homeostasis in the body. Something is off. Metabolic program for us, as how we discuss it and how we agreed on, is that we help patient to understand and to take charge of their own life. We only guide them first. So the metabolic program is basically, imagine it as to reset everything, reset your metabolic health as simple as possible. And of course, guiding them throughout the whole journey, because definitely it's not easy. Of course, especially when you have already, have that specific lifestyle where you're always used to this type of food, the sedentary lifestyle, the stress. So it's going to be tough, but that's why we're here.
Yeah.
That's why we're going to help everyone.
Yeah. What about you, Dr. Krish? What do you think? Do you have anything to talk about, like the program? What does it entail? How can it help our patients?
Okay,
Yeah.
so I think what we have seen from our clinic and all the walk-ins and all the appointments that we see every day is basically most patients have the same concerns, right? Most of them come in with almost the same concerns. And I think Malaysia has been declared the sweetest country in the nation, right? So obviously we are burdened with this big metabolic problem. And as we know, the government clinics, they don't have the time. And they do not have the means to actually do these kind of programs because they're very disease oriented.
Yeah.
So I think as a clinic like ours, where we are specialized in healthcare, not in sick care, we will be able to run this program very well. And what is good about this program is it gives patients options, gives them the chance to let us know what exactly they want. And it is personalized to a certain extent because based on every patient, we tweak the programs. Of course, the program has a general thing to it, but we tweak it according to what the patient needs. And since we have two, which is the holistic and the program with support, the holistic, should I explain what it is?
Yeah,
Okay.
that would be great.
So the holistic program is more basically dietary reset, dietary planning, and then their lifestyle changes, their fitness programs, and it's also a multi-team
Yes.
approach where it's not just going to be us, it's going to be together with a dietitian, a functional coach, a fitness expert. And of course, we're going to do a lot of lab tests as well to see where they stand in terms of lab parameters, and a very detailed inquiry into the exact kind of food they eat, and what kind of lifestyle they have. We already know now in Malaysia, we have this problem of too much food and too little movement,
Yeah.
right? I
Yeah.
think that's the basic problem, and that's why we are having this metabolic crisis, so to speak. Too much food, too little movement, and too much food throughout the day.
Yeah.
Right? Thanks to our mama shops, we
7-Elevens,
get food
yeah.
like all the time. So part of this program is actually to teach people how to eat for your body and eat for your health, right?
Yeah.
And of course, for those who are grossly overweight and who have more problems and who need more help, sometimes the holistic approach alone doesn't give them the motivation that they need. And these are the patients that actually will need something a little more. So, and then nowadays, of course, we are faced, or rather we have been blessed with peptides.
Yeah.
So
So yeah, we're just talking about peptides, right? So GLP-1 agonists like, Ozempic, Wegovy, Manjaro, and then Manjaro recently launched in Malaysia, like literally 1 week ago. We both went for the launch, Dr. Krish.
Yeah.
And it's taken the world by storm. I don't think it needs any introduction. Everyone knows about these peptides. Manjaro alone is projected to generate $60 billion sales by 2030. Right, and I mean with supply chains which is better than Ozempic, because we all saw what that happened. Like with Ozempic, it was really hard to get to. It was really hard to get Ozempic. It was like there was a worldwide shortage, right? The question is like, how would this, impact weight loss management? I just want both of your opinion. Like, what do you guys think? How does the weight loss peptide come into this whole weight loss management and how we practice in the Rosewood Clinic, or how we, apply this to our patients? What do you think, Dr. Krish?
okay, so you're right. Peptides does give us a little bit of help in terms of weight loss, and I guess a lot of patients would want to be on that bandwagon, the peptide bandwagon,
Yes.
right? Because they would feel that it would make their weight loss journey much easier and faster to move. But of course, we would select the patients accordingly based on their health. We're going to screen them, and we're going to see who would be the ones who are suitable for. And some of them, they may want it, but they may not actually need it.
Yeah.
So this is where we hold their hands and guide them, as to which program they should go for. But you are right. With peptides, it has other areas also, not just weight loss. It does reduce fat. It does reduce appetite. It does, makes it easier for them to eat less. So definitely the peptide inclusion in our metabolic program would help them a lot, definitely. But what we would do that would be very different from a conventional weight loss setup in a hospital would be that we would plan for them to eventually be without it one day.
Yeah, I agree. GLP-1s are really powerful. I think they are powerful tools that we can use, to help our patients lose weight. But it shouldn't be the only thing, right?
Yeah,
It's
exactly.
the combination of everything, looking at their diet, nutrition, lifestyle, exercise. A lot of our patients don't exercise, right?
Yeah.
And so getting them to move more, doing more weight training, also looking at their sleep, hygiene, stress management, because all of that also factors in and also affects weight issues, right? Weight gain. So patients don't just lose weight, but they truly reset their metabolism.
Exactly.
Right?
Yeah. So
So-
their cholesterol levels come down.
Yeah.
The liver enzymes normalize. The kidney is functioning very well. The sugars, of course, come down really well. And so generally, they are at a better metabolic state than they were 6 months or 12 months before that. That is something I think this program almost 99% guarantees.
Yeah.
If the patient is motivated enough
Yeah.
and is willing to stay on the journey with us, we definitely can achieve that.
Yeah. Because it's not a short-term plan.
It's
you know,
not.
It's a
It's not,
long-term
yeah.
plan.
Yeah,
It's a long-term
But
plan. Yeah.
but a lot of our patients
Yeah.
sometimes they want a quick fix, and then they think that it's just going to be okay by end of the year. I want to lose this amount of weight. I want to look good for this occasion or this event, right? But it's about changing their whole entire outlook of how they look at their diet, their lifestyle, and then truly resetting all of that so that they don't have to depend on all these other things, right?
Exactly.
Yeah. So it
that's
should be
why
as a
patient selection is also very important.
yes.
Not all patients are suitable to get started right ahead with peptides.
Yeah.
Exactly.
Yeah, so we also need to inform patients that this will not be your end goal.
Mm-hmm.
Your end goal is to be without it.
Yeah.
Okay, this is just to help you out. But in helping you out, you need to actually change your lifestyle
Yeah.
together with it.
Mm-hmm.
Yeah. So
yeah.
people have to be well aware of when especially when they're using peptides. So misusing it can be very detrimental. So that's why it's good that we bring the program as well, so that we can guide patients and we can inform them from time to time again and just remind them, you're good. You're almost there. You're already good to go.
Yeah.
Yeah. I feel like people just need the support,
Yeah.
right?
Exactly. Yeah.
Yeah,
Yeah.
because it's like it's just empowering them, kind of like guiding them as well, giving them the power back.
Yeah.
It's not just within us. I think they also need to know that they are powerful. They can change their lifestyle, right?
Correct.
Not a lot of people can be like Dr. Krish, where they are able to, adhere to this strict diet and change a lot of different things. It's not easy, but it's doable, and I think it's possible, right? It's
But
just
I think once
guiding.
they start feeling so good,
Yeah.
once they've achieved that kind of health and they feel so good, I don't think they want to let that go. Honestly,
Yeah.
why would anybody want to let
Yeah.
that go, right?
Yeah.
I mean,
Yeah.
you've achieved something so valuable.
Yeah.
You don't want to let that go.
And
so,
once
so patient
you-
selection,
yeah.
like what you said, is
Yeah.
really important.
Yes.
because
And-
they have to want it.
Yeah. So when they've changed their lifestyle, they would notice not just the weight, not just the inches that they've lost, but the mental clarity. They can work better. They can, the brain fog reduces, improves. The energy is
Yeah.
so much better. They can wake up in the morning easier. They don't have the afternoon crash where they need a nap every day. And people would love that.
Yeah.
People would feel good about themselves. Yeah, so that's why that's how we actually help patients.
Yes.
And the end
agree,
message
yeah.
is they know they did it
Yes.
by
Yeah.
themselves, right? And so in the future, even if they go off the wagon, they'll know what they need to do
Yeah.
to get
Yeah.
back on it again.
Yeah.
Without even seeing us, because they know what they need to do. Yeah.
I just saw a patient yesterday and she was struggling with weight gain issues for the last 6 months. I think she put on about 5 kilos. And she told me that, she had to do a few blood tests because, it was just getting out of hand. And so she went to a local hospital, like a private hospital, did some blood screening. And so she showed it to me. But when I looked at it, it was very basic, right? So it's just got the full blood count, kidney, liver, cholesterol, which is always normal when you look at them, right?
Yeah.
And so, when dealing with weight loss issues, we really need to dig deeper, right? So that's why we have to look at a lot of other markers.
Yeah.
Yeah.
And, one that's very important is thyroid.
Gut?
Gut,
Gut
yes.
health. Yeah.
Insulin levels,
Yeah.
right? So there's a lot of other markers that we need to test for.
Exactly.
And this is why, when we do our blood test, it's very comprehensive.
Yeah.
Because we may be dealing with a few different things here. And it's not just one thing. It could be
Yeah.
a few different things all together.
Yeah.
Or it could just be the thyroid. It could just be a cortisol issue, right? All of that impacts weight gain.
Well, we've seen a lot
Yeah.
of people who are stressed at work, who lead very stressful lifestyles, do gain a lot of weight.
Yes.
And when we do check their cortisols, it's very,
Very
high.
high. Yeah.
So, and also a lot of them have a lot of gut issues. So this
Yes.
program actually, one of the good things about this program is it actually includes gut reset.
Yes.
which we go through with them and look at their gut again, and then use nutrition again to help them reset their gut, which is something very something for their long-term health as well.
Yeah.
Yeah.
And especially on gut, apparently, people think that going to the bathroom for bowel movement every 3 days is normal.
Yeah.
Because that's what they were told. Oh,
Yes.
you have that gene whereby your bowel movement is every 3 days. So it's,
Hypotonic bowel.
yeah, so you're normal.
Yeah.
So that is actually not.
Yes.
That is one of the earlier red flags would be. So bowel movements is as important as other markers. As simple as how many times you go to the bathroom in a week. As simple as that.
Yeah.
Yeah. So that's
very,
why
very
for
interesting.
me,
Yeah, very
So-
interesting, because I was at an event recently with my husband, and one of the speakers, they asked for like some key home takeaway messages, and one of the speakers actually said, make sure you have a good poo every single day.
Yeah.
And I still remember it because, it was a
Yeah.
good message, and it's actually true. You need to
Yeah.
make sure that you have good bowel movements.
Because we
Right.
eat on a daily basis,
Yes.
if not 24 hours.
Yeah.
But then you're only eliminating whatever foods that you ate every 3 days.
Yeah.
How is that healthy, or how is that good for your body? Right?
Yes, agree. Yeah, so looking at the gut, that's very, very important. And I think you guys would agree with me. Most of our patients who have a lot of weight gain issues or are overweight or obese has a lot of inflammation and also has a lot of gut issues, right?
Definitely.
Yeah.
Yeah.
And also, I think what's good about this program is there are a lot of diet fads going on, and a lot of patients are just following random diets,
Yeah.
without actually knowing what's best for them.
Yeah.
So in this program, we get to sit with the patient and decide what's the best diet for them
Yeah.
based on their lab results, based on their general health,
Yeah.
Yeah.
and also maybe get a little bit of genetic information from the health of their family members and
Yeah.
their parentage histories
Yes.
to really know, what's their background history in terms of family health. That
Yeah.
also helps us.
Yeah.
Because in Malaysia now we're leading
Yeah.
the globalized, a very global population where we see a lot of people from all over the world actually, right?
Yes.
So we see people from different community backgrounds.
Yeah.
Yeah. So all this also plays a role. It's not
Yeah.
just one. It's not just one. What's the term they always say?
It's not the one size fits all.
Yeah, one size fits all. Yeah, it's
Greg
not one
always
size
says it.
fits all. Yeah, it's not.
Yeah.
It's definitely not. Yeah.
Yeah.
So
Yeah,
that's
it's
another
very
thing about
personalized.
this. Yeah,
Yes,
very
yes,
personalized and very
personalized,
precision
yes.
based. It's very precision based
Yeah.
also
Yeah.
because we are looking at every individual. Yeah, based on their lab tests.
Yes. Yeah, and I like that you mentioned about the DNA test, because I used to, recommend it later when I feel a little bit stuck. With my patients, I'm doing a lot of these different things, but we're just not seeing, results, or we're not seeing the kind of like good end goal, right? And so nowadays, I just do it much earlier, and I feel that it really, really is a huge game changer for me, especially in how I manage patients. I mean, what do you think? I mean, the DNA part, the nutrigenomics.
If we want to do DNA testing, it gives us a lot of information on metabolic health because and if a patient really wants to take charge of their health, and if they can afford it, they should do a genetic test in terms of getting more information about their metabolism.
Yes.
There's a lot of information there that a blood test doesn't give us.
Yeah.
So that's also added information for us to use to get the patient to go where they need to go.
Yeah.
Yeah.
And I found out something really interesting. I heard from a colleague of mine who attended this DNA conference recently, which Dr. Mark Hyman uses this DNA test, right? And she said that Dr. Mark Hyman does not see a patient unless they
Unless
have
they've
blood
done
work and a DNA test.
Yeah.
Oh, wow.
Yeah. So I think that is the future of all medicine.
Because that's again what we
Yeah.
said about personalized, right?
Right,
So
yes.
if you have certain genetic markers that actually predispose you to a certain kind of metabolic derangement,
Yes.
then you teach the patient what they need to do because
Yeah.
they already have that gene
Yeah.
with them.
And
Yeah.
interesting fact that most people, I mean, at least the patients that we
Yeah.
see, when they're talking about their symptoms or the signs, they would always say, yeah, because my parents have them. Yeah, because my parents have them. I genetically genetically predisposed
Yeah.
to this disease.
Yes.
And then when I straight up tell them, correct, not everyone is perfect. Everyone might be born with, certain people might be born with certain DNA, certain genetic code, but it does not mean that you're doomed for that bad code. Your lifestyle decides which gene you want to turn on and which gene you want to turn off.
Yes.
So,
Very
so
spot
that's
on.
what most people don't know. They feel like, oh, I'm doomed. My parents have this disease and I'm supposed to have this disease later on in life.
Yeah.
But that's not it. That's not the whole story.
Yeah. I mean, it's important to understand your DNA, your blueprint,
Yeah.
but it only makes up about 35%.
Yeah.
Exactly.
The other 70%
It's
is
your
your
playing
lifestyle.
field.
Yeah.
Yes,
It's your
exactly.
playing field.
Yes.
Yeah.
Yeah. So if you want to take control of your metabolic health, the time is now. Visit us at the Rosewood Clinic if you want to learn more about what we've been talking about today. And our launch of the program is on 12th of September. So reach out to us so you can find out more about it.